Welcome to On the Beat, everyone. I'm over here with Dr. Cameron from the Huxford Clinic. Now, you may not know you have this problem, or maybe you do, but I'm sure someone in your family knows you maybe have this, and we're talking a little bit about sleep apnea. Welcome to the show, my friend.
Thank you very much.
All right. Is sleep apnea someone who snores?
Not everyone who snores has sleep apnea,
Okay.
but often those who snore very loudly will have sleep apnea.
Okay, what happens if I wake myself up from my snoring? Does that mean I have sleep apnea?
Probably so.
Oh.
Or gasping for breath, or choking, or coughing. Those are all signs.
Really?
Yes.
All right. Maybe you know at home whether you have sleep apnea, maybe you don't. But let's break it down and really give everyone at home, in layman's terms, if you wouldn't mind, Doctor, what is sleep apnea?
Sleep apnea means you quit breathing at night. The typical symptoms are loud snoring, excessive tiredness during the day, and you maybe wake up short of breath or gasping for breath, or a spouse or a family member or friend says that they witness you quit breathing at night, or there may be a pause in your breathing.
Are there different levels of sleep apnea? So I said earlier on that I was joking when I said I wake up from myself from snoring, but I'm not gasping for air that I'm aware of.
Right. Most of the time, I would say most of the time people do not know that it's going on.
Really?
Because they're asleep. The quality's not very good of the sleep they're getting, but they are asleep. So we're dependent on other people mostly to help to determine it.
Okay, now you just said that. What about if we were to, do you send your patients to a sleep clinic?
I am the sleep clinic. So
yes.
we
come to your office and have a snooze?
Well, you come to my office to hear about it, and then we send you to the place to get the snooze.
I want to delve into, if I come into your clinic and I think I am suffering from sleep apnea, do you do the sleep testing there, or do we go somewhere else, or how does that work?
No, we determine if you need it or not, and if you do, we will send you for a sleep study. Typically, it will be done in lab, in a formal sleep lab situation, but depending on insurance, sometimes you may have to do it at home.
Okay, well that's both options there.
Correct.
Before we go, I do want to ask you, is having sleep apnea dangerous? Can it kill you?
It can be dangerous. There's a lot of studies that show there's a link between untreated sleep apnea and high blood pressure, diabetes.
Right.
It also increases your risk of heart attack, stroke, and rarely you can die from it.
All right, well, in our next show, we're going to talk a little bit about how we can treat this and what we can do about it, right?
Yes, sir.
Okay, so one other thing before I go, you did say something about insurance. So is these treatments that we're going to talk about part of that insurance?
Yes, if you qualify, if you have sleep apnea based on the results of your test, the insurance company will pay for the treatment.
That's what we want to know, building a healthier future. Thank you so much, we really appreciate it.
You're welcome.
If you want to find out more about the Huxford Clinic, there's all the information on the screen for you. Dr. Cameron, he is the man to see. Back after this short break, everyone.